My name is Evelyn DeJesus. I'm a nurse manager here in the Trauma Surgical Transplant Unit in Bliss 7I. I've also had the opportunity of being a patient here. I had preterm labor difficulties. Well, I think nurses are not built to be the patient. We're built to be the strong ones, we're their caretaker, we're the ones ready to resolve and meet other people's needs, and to become the patient or take the seat of the patient for me was very difficult, and I dare to say for any nurse it's a difficult and very challenging thing to do. Every single nurse that has earned those RN beautiful initials after their name, we struggle for perfection, so we're perfectionists at heart. I was in pain, I was confused, I was scared. In my head, nursing, it's change of shift, do we have enough nurses? You know, all that stuff that happens on the real world. And then I just took a deep breath, I looked up, and there was these three amazing, warriors, my nurses. They huddled in less than a minute. They devised a plan. One took care of my pain, one took care of my nausea and vomiting, the other one took care of my dignity. They all hovered over my husband, all in like a split second. And next thing I knew, when I looked at the end to the foot of my bed, the hands that were embracing my baby weren't anybody else's but the hands of my nurse. That was the person at the bedside that delivered my child safely to me.
My name is Krista Wells, and I am the unit leader in the emergency department, and I was also a patient. I came into the emergency department with some pain on my side. I wasn't sure really what it was. I thought it could be a kidney stone or something along those lines, but at that point in time I was too scared to really make sense of what was going on. Being on the other side of the stretcher, you look around, you're scared. I have a lot of knowledge as to what's going on, especially being a nurse and practicing in the emergency department. It takes a little bit of time to really come up with a good diagnosis. So of course I was scared and nervous, even though I did have knowledge of what was going on. I had nurses that took care of me, that gave me medications, had a scan, had some ultrasound, and then it was a diagnosis of a kidney stone. When you really do understand the frustration and the anxiety that person is feeling at that point in time, you can really look at them and attend to their needs, whether it be a pillow or it's something as simple as a cup of water if they can drink it or something along those lines. Those little details are what really matter.
My name is Julie Massie. I am a nurse on Bliss 8 and also have been a patient. And one day everything changed back in October of 2009. My life changed forever. I was working, waiting for the doctor to give me some results on an MRI I had done that day before. And she came up with tears in her eyes, and I knew it wasn't going to be good news. I was diagnosed with stage 3 invasive lobular metastatic breast cancer. You almost didn't expect it. You expected her to call and say everything's fine, nothing to worry about, but it changed things forever. After I was diagnosed, when I saw a patient sitting in their room by themselves, I'd take the time to go in and sit and talk to them, and I'd share my story with them so that they'd have somebody to look to, somebody else that's been through it also. I'm not just a nurse that's, here to hand out medicine. I've been where you are right now. I always thought as a nurse I knew how to take care of my patients, what they needed. Being on the other side of the curtain and waiting for those results, it puts you into a whole new perspective on what it feels like to be a patient. I do think I'm a better nurse. I feel like I'm more compassionate now towards my patients. When I put my face with being a survivor, I think that they look to me for inspiration. They don't expect you to come out and say, I'm a cancer survivor too, and everything's going to be okay. You tell them sometimes just put one foot in front of the other, and it'll get better.
It made me more compassionate, a little bit more empathetic. I always felt like I had compassion and empathy for people, but it made me really take a look at the patient as a whole and see that this is necessarily the worst day of their life, and that they need someone to be there and to understand their frustrations, their anxieties, their pain.
Now I feel I'm a better nurse as a result of everything I've been through. I'm able to empathize and be more compassionate with my patients.
We do these amazing things that for us feel like this is just what I signed up for. But I want to tell those nurses that they touched my life and they've impacted the memory and my experience as a patient that will never be changed. And that they do that so many times every day.